Good afternoon. I appreciate the invitation by Minister Hamilton and Dr. Hensel to participate in Schwartz Rounds. Today, men and women will share stories about racism and living in America. I'm going to begin with the story. My parents grew up in rural Alabama, married, and moved to Boston. And every summer in the 1960s, my father would drive his family, 8 children, to rural Alabama to visit extended family. Our mother prepared food for the trip, and we would pull over while driving or after driving and eat those meals picnic style. We would then use the bathroom behind the bushes and load back in the car and drive until my father got tired at night, stopped at a designated safe rest area, and we spent the night sleeping in the car. As the youngest of 8, I enjoyed those trips, but I didn't realize until perhaps a decade or so later that our parents didn't travel that way because we were poor. They didn't travel that way because they were really frugal, but they traveled that way because they were protecting their children from the indignity and humiliation associated with legalized racial segregation and discrimination in the South, known as Jim Crow. You see, at that time, African American people could not eat in the same restaurants as white people. We couldn't use the same bathrooms as white people. We couldn't sleep in the same hotels or drink out of the same water fountains as white people. And if we did, we could have been arrested and placed in jail. And unfortunately, the experience of legal segregation and discrimination was also present in healthcare. The practice of no healthcare or limited access to healthcare based upon race caused racial inequalities in healthcare access and healthcare outcomes. Those racial disparities in health today remain due to systemic racism as well as unconscious bias that's embedded in healthcare and is embedded in society. In the late 1890s, Dr. W.E.B. Du Bois, the first African American social scientist to graduate from Harvard University with a PhD, was one of the first to recognize that sociology and not biology was responsible for health disparities among different racial populations. Today, we call those differences social determinants of health. In addition to social determinants of health, research reveals that unconscious bias results in unequal treatment of patients of color despite similar disease states, income, and insurance as white patients. So many have declared, in fact, that racism is a public health issue. And as we look at today's topic, I believe that the real issue is systemic racism in America, and the Black Lives Matter movement is about being anti-racist. As a physician, I often ponder the story of the Good Samaritan, the parable in the Bible about the man who went down a dangerous road and he was robbed, beaten, brutalized, his clothes were taken, and he was left half naked and half dead. A priest traveled down the road and saw him and passed by him. A Levite then traveled down the road and saw him and passed by him as well. And then a Samaritan traveled down the road, saw him, and he had compassion. And although the Samaritan and that man were of different races and in fact sworn enemies, the Samaritan stopped and tended to this man's wounds. He put the man on his donkey and took him to the local inn and continued to care for him. And after a couple of days, the Samaritan had to leave and gave the innkeeper some money and asked him to continue to care for the man and promised to pay him whatever he owed him upon his return. Ladies and gentlemen, I don't know if the priest or the Levite were exercising their unconscious bias, whether they were exercising their privilege as they walked past this man. I don't know if they were racist or if they just lacked compassion. But what I do know is that the Samaritan acted out of a compassionate understanding of a need. He left his comfort zone, that tradition steeped in racism, and he acted. He was not complicit in his silence, but he was in fact anti-racist. As we discuss the topic of racism today, there may be feelings of awkwardness, discomfort, sadness, or in fact, anger. As individuals share stories, realize there are many more stories lived daily by many other people. Discussions about the horrible history of racism in America is often difficult. To paraphrase Frederick Douglass, change cannot occur without a struggle. Personal or internal change requires personal and internal struggle. Institutional change requires institutional struggles. I hope each of you leave with a better understanding of the impact of unconscious bias, institutional or systemic racism in healthcare in America. I hope you leave with a desire to act, to not be silent or complicit, but in fact, to be anti-racist. It's a great goal for all of us. Have a good meeting.